The smell of a hospital after midnight is specific. Bleach gone cold, the ghost of dinner trays. Something biological underneath that the bleach is always losing to, shift by shift. I know that smell, the way I know the smell of a burning vehicle, and copper and red dust, and the sharp alkaline note of an IV bag punctured in a hurry. They called me the agency nurse, the temp, the woman on the staffing board with a last name and a license number and nothing else. That arrangement had suited me for 14 months. Then I tried to walk out of Meridian General Medical Center for the last time, and every exit I could find had a man in front of it who was not there for me to go. Let me tell you what I had done to deserve that. My name is Sarah Kovac. I am 36 years old. I have 2 plates in my left forearm from a surgery I had done at Landstuhl Regional Medical Center in Germany by a surgeon who told me I would probably never have full grip strength again, and who was wrong, which I have always appreciated about him. The plates set off airport security, and I have a card for them, and the card has a different job title on it than my nursing badge does, and I keep the card in a different wallet. I took agency nursing in Harlow Falls, Oregon, because agency nurses move hospital to hospital on short contracts, and nobody accumulates enough familiarity with them to ask the questions that accumulate into a picture. And a picture was something I was not yet prepared to let anyone have. Meridian General was a Level 2 trauma center, serving 3 counties and an interstate corridor, which meant it ran hot in ways a smaller rural hospital wouldn't. And hot suited me fine. The kind of busy that makes people look through you rather than at you. The ER smelled of cold tile and hand sanitizer, with a lavender note that the charge nurse, Margaret, applied every 40 minutes with the devotion of someone performing a small, private ritual. It drove me slightly insane. Lavender made me think of Kandahar. I never told Margaret that. I just breathed through my mouth for the first 2 hours of every shift and then forgot about it. I checked the exits the first day. Loading dock, southwest. Ambulance bay, north face. 2 automatic doors with a manual override on the left panel. Fire exit, east stairwell, alarmed after 1800 hours. Parking structure access, internal corridor, sea level. I did not decide to inventory these. My body did it. My body had been doing this for 11 years and saw no reason to stop simply because I was now in scrubs rather than kit. To the ER staff at Meridian, every shift was a contained emergency. To me, it was a rhythm. I had worked rooms where the emergency was not contained, where the walls were not reliable, where the decisions you made in the first 60 seconds were the ones that answered questions with permanent answers. A busy Level 2 ER with a stocked crash cart and 3 trauma bays was not an emergency. It was a puzzle I already knew how to solve. My hands knew things. That was the most honest way to describe it. They knew where a vein was before the light confirmed it. They knew what a failing IV line felt like at the tape before the pump alarmed. They moved through the night shift's work with a precision that I had learned to make look casual, because precision that looks precise draws the wrong attention, and the wrong attention was something I could not afford. 3 agency nurses before me had been offered staff positions at Meridian. I had declined twice and was preparing to let the contract lapse for a 3rd time, which is how I had managed to stay invisible for 14 months without anyone formally noticing the shape of what I was hiding. Dr. Cressida Vane was the ER medical director. She had been the ER medical director for 9 years. She had a manner that I had categorized in my first week as the specific confidence of someone who has never been the least qualified person in a room they've entered and has ceased to wonder about the rooms they haven't. She wore her white coat with both buttons fastened, which, in my experience, is an indicator of a person who considers the coat a statement. She was 46, precise, brunette, and she spoke to the agency nursing staff the way someone speaks to a service, acknowledging the function without acknowledging the person performing it. This had not bothered me for 14 months because I was not at Meridian to be acknowledged. I was there to do the work and disappear. What she did at 11:40 on a Thursday night bothered me. I had been at Bay 9's workstation completing an intake assessment on a 63-year-old man named Gerald Tate, who had been brought in by ambulance presenting with chest pain that his paramedic had called possible cardiac in origin, and that I had assessed, in the 90 seconds I'd had with him before the attending arrived, as something else. The ECG was unusual, not the classic tombstone elevation of an MI, a subtler pattern. I had seen it before in a different context: high altitude, cold exposure, a specific kind of exertion-related stress, and I had noted it in the intake and flagged it for the attending with a specific recommendation. Dr. Vane reviewed the chart at 11:42. She reviewed it at the nursing station, which means she reviewed it at volume, because Dr. Vane did not use an interior voice when a public one was available. "Who wrote this assessment?" "I did," I said. I was 2 bays away. She looked at me with the flat appraisal of someone deciding whether to engage or dismiss, and settling on dismiss as the more efficient choice. "Agency nurses complete vital signs and intake documentation," she said. "They do not append clinical interpretations to ECG findings. That is not within your scope." She set the chart down. "And frankly, this interpretation is incorrect. Mr. Tate is a straightforward ACS presentation. Please restrict yourself to your documented responsibilities." The unit clerk had stopped typing. 2 nurses at the station had found urgent interests elsewhere. A resident who had been walking past slowed slightly, then thought better of it and kept walking. I looked at the chart. I looked at the ECG strip clipped to it. The J-point elevation in V4 and V5 combined with the T-wave morphology is more consistent with Wellens syndrome, type B, I said. It needs a cardiology consult before he gets sent to a standard floor. "Are you a cardiologist?" "No." "Then you've answered your own question." She picked up the chart. "Stay in your lane, please. We have the rest of the night to get through." I stayed in my lane. I stayed in my lane for 3 hours, which is how long it took for Gerald Tate's pressure to drop on the floor and the code team to be called, and the cardiology fellow to look at the original ECG strip and say, clearly and with feeling, exactly what I had said at 11:42. I was not there for this. I heard it from the nurse who came to find me in the supply room at 3 in the morning to tell me that Tate had gone to the cath lab and that it had been very, very close. I sat with that for a moment, and then I went to the nursing station, and I picked up the charge clipboard, and I wrote the date and time and the word resigned at the top of the agency nurse contact sheet, and I signed my name under it. I set the clipboard back down on the counter. I took my badge off and set it on top of the clipboard, and I picked up my bag from the hook beside the break room door, and I walked toward the ambulance bay. The man at the ambulance bay doors was in civilian clothes, dark jacket, hands loose at his sides, standing 2 feet from the automatic door sensor in the specific way of someone who has positioned themselves to block without making the block obvious. He was looking at his phone. He was not reading anything on it. I knew this because his eyes were not tracking. I stopped. I looked at him. I looked at the door. I looked at his hands. And then I turned and walked to the east stairwell. There was a man at the east stairwell, too. I went back to the main corridor and stood very still for a moment with my bag on my shoulder and the particular quality of attention that takes over when your body has decided that whatever is happening is something it has a protocol for. My pulse was 114. I knew it was 114 because I was counting. I had not made a decision yet. I was collecting information. I walked to the loading dock access, the southwest exit, and then I stopped in the corridor before I reached it, because through the safety glass window in the door, I could see the dock was occupied. Not by a delivery, by 2 men with the specific posture of people who are waiting and have been waiting for a while and are very good at it. Every exit I could see had someone at it. My hands were cold. They get cold when adrenaline redistributes the blood to the places the body has decided it needs more urgently. I had learned this about myself in Kunar province in 2015, and I had never unlearned it. I stood in the corridor with cold hands and made myself think slowly. And then I did the assessment. They were not positioned offensively. Nobody had made a move toward me. The body language at each exit was patient, not aggressive. Whoever these people were, they were not here to harm me. People who want to harm you do not block exits first. They enter first. They were here to stop me leaving. The specific question was, why? I turned and walked back toward the nursing station. Margaret, the charge nurse, was standing at the station with an expression I had not seen on her in 14 months, which was an expression of genuine uncertainty. Beside her was a man I did not know, Army, out of uniform, which I identified from the cut of his hair and the angle of his chin, and the way he occupied a space as though he had assessed its dimensions before stepping into it. He was a colonel. I did not know how I was certain of this. I was certain of it. He was looking at me. He had a photograph in his hand. He looked at the photograph. He looked at me. He put the photograph in his coat pocket. Kovac, he said, not a question. The pronunciation was correct. Kovac, not Kovacs, which meant someone had briefed him on it, which meant this had been planned. Nobody at the nursing station moved. Nobody spoke. I set my bag down on the counter. The exits, I said. Precautionary, he said. We needed you to stay. You could have asked. Something moved in his face that might have been a concession. We weren't certain you'd agree, he said. That was probably accurate. I had been not agreeing to things for 21 months. I had become extremely proficient at it. What do you need? I said. He told me. There was a Special Forces medical sergeant named Vasic who had been extracted from a training exercise gone wrong 40 minutes north, and the nearest trauma center was here, and what had been a training exercise had resulted in a closed head injury with escalating intracranial pressure and a pattern of neurological deterioration that the medics on site had identified correctly and stabilized inadequately. He was alive. He was losing ground. The military's own surgical team was 37 minutes out by air, which was 37 minutes more than they had. And there was a specific procedure, a burr hole cranial decompression, that the surgical staff at Meridian had performed a combined total of 3 times, and that one person, formerly attached to the 75th Ranger Regiment, had performed 11 times in the field, under conditions that included darkness, altitude, and sustained enemy contact. That person was currently wearing scrubs and holding an agency nurse badge in her hand. Vane won't clear me, I said. Dr. Vane, the colonel said, has been on the phone with her hospital administrator for the past 6 minutes. She will clear you. I looked at my hands. They were still cold. They would warm up when they had something to hold. Where is he? I said. Vasic was in Trauma Bay 2. And when I walked in through the bay doors, the attending who had been working him looked at the colonel 2 steps behind me and stepped back without a word. And then the medic who had come in with Vasic, Okonkwo, tourniquet on his own left arm, someone else's work and not bad, gave me the handoff in the sequenced, specific language of someone who is trained for exactly this kind of transfer, and I received it in the same language. Vasic was 31. Blunt force to the right temporal region, progressive right pupil dilation, GCS of 9 and trending down. Cushing's triad was beginning to declare itself. We had a window, and the window was not wide. I need a standard burr hole kit, I said to the resident standing at the supply cart. His name was Baines. I had worked with him twice. He was good under pressure in the way that some people are good under pressure without knowing it yet. Twist drill, sterile field. And I need someone to call Neuro on the phone and keep them on the phone because they will want to hear what I am about to do, and I would rather have them listening than arriving. He moved. My hands had warmed up. They were precise in the way they got precise when the situation removed the option of being anything else. I had 11 previous versions of this procedure in my muscle memory, and they were all present and accounted for, arranged in the order of most to least complicated. And this one, a level 2 trauma center with a sterile kit and a viable patient and no incoming fire, was not the most complicated version. I worked the way I had always worked in the rooms that had asked the most of me, steadily, without commentary, talking to Vasic in the low, even voice that is not protocol, but that I have always believed is the part of the intervention that doesn't appear in the textbook, but that the patient feels anyway, even unconscious, especially unconscious. His name, that we had him, that there were people waiting for him that I was going to help him get back to. I found the landmark at the temporal squama, and then I placed the drill at the correct angle, 30 degrees from vertical, anterior to the coronal suture above the temporal line. The kit was good, and then the pressure release when I breached the dura was immediate and definitive, and I held the position while the intracranial pressure equalized. And I counted in the rhythm I had learned from a neurosurgery physician's assistant in Kunar, who had taught me this procedure on a sheep skull in a converted storage container, and who had been completely serious about every minute of it. Vasic's left pupil, which had been threatening to match the right, began to respond. I exhaled, once, through my nose. "Baines," I said, "get the neurosurgeon, now." The neurosurgeon arrived 4 minutes later and stood at the bay threshold and looked at what had been done with the expression of a person whose entire framework for a situation has been revised in under 10 seconds. He looked at me. He looked at the colonel. He looked at Vasic, whose pupils were now bilateral and reactive. "He needs the OR," I said. "The decompression will hold, but there's underlying contusion he needs imaged and managed. You have time." He bought it. The neurosurgeon looked at me for one more moment. Then, "Get this man to imaging," he said, "and then the OR." And then to me, very quietly, in the tone of someone who does not say things like this casually, "Good work." I peeled the gloves off and dropped them in the bin. I was sitting on the bench in the corridor outside the supply room, the same bench where I ate lunch on the nights when it was slow enough to eat, when the colonel found me. He sat down on the other end of the bench. We were quiet for a moment. "How long?" I said. "We've known your location since month 3, he said. "We left you alone. It wasn't our call to make." "What changed?" "Vasic," he said simply. I looked at the corridor. The fluorescent light at the far end was flickering. I had meant to report it and hadn't, because reporting it required talking to maintenance, and talking to maintenance required a slightly longer conversation than the one I had been willing to have in this building. "I put in my resignation tonight," I said. "I know. Before all this. I know that too." We were quiet again. "Osei is asking about you," he said. That one landed differently. I had not heard that name in 21 months. "Tell him I'm still here," I said. "Tell him I'm still in one piece." The colonel nodded. He stood. He straightened his jacket with the specific two-handed motion of someone returning to a professional posture after a human moment. He reached into his interior pocket and removed a folded document. He set it on the bench beside me. He did not make a ceremony of it. "That's yours," he said. "For the record." He walked back toward the ER. I looked at the document for a moment. I did not pick it up immediately. I sat with it the way you sit with things that contain a version of yourself that you have been carefully not looking at. And then I unfolded it. Sergeant First Class Sarah Kovach, 75th Ranger Regiment, 2nd Battalion. 4 operational deployments: Iraq, Afghanistan, Kunar Province, Syria. Special Operations Combat Medic qualification. Silver Star, awarded for actions in Kunar Province on March 9, 2018, in which Sergeant First Class Kovach, under direct enemy fire and with 2 personnel incapacitated, performed field cranial decompression on a critically injured ranger while directing a 3-person perimeter defense, sustaining the patient until extraction and receiving wounds to her left forearm in the course of the action. Army Commendation Medal with Valor, Combat Medical Badge, Call sign, Saber. I folded the document back along its original lines. I had not read those words in 21 months. I had not needed to. They had been in the plates in my arm and the count I used for burr holes and the way I stood at an exit to be in 2 directions at once for 21 months without ever requiring a page. I put the document in my bag. I picked up my badge from where I'd left it on the counter. I had apparently brought it with me without deciding to, and I turned it over in my hand. At the nursing station, Margaret was pretending to do paperwork with the focus of someone who has just witnessed something she does not have a category for and is waiting for the categories to form. The 2 colonels who had been in the ER were in the corridor. The men at the exits had moved. The east stairwell door opened and the man who had been there walked through it, heading out, because that was no longer necessary. I thought about Vane. She was somewhere in this building, in her office, I imagined, on her second phone call of the night. I did not have anything I needed to say to her. The patient I had flagged at 11:42 was in the cath lab and had arrived there with enough time. The patient I had just stabilized was in imaging. These were the facts. The facts did not require commentary. I stood up. I put my bag over my shoulder. I walked back to the nursing station and set my badge back on the counter next to the clipboard with my resignation on it. I picked up a pen. I drew a line through the word resigned, and then I wrote next to it, temporary leave, pending. Margaret looked at the clipboard. She looked at me. Something in her face did a specific thing that I did not look away from. Night shift needs someone for base 6, she said, in the careful voice of someone who has decided to be matter-of-fact about something that is not matter-of-fact. I'll take it, I said, and then I walked to base 6. I pulled on gloves. I began the intake assessment on the patient in the bed, a woman in her 50s with a fractured radius from a fall, frightened and cold, who looked up when I came in and whose shoulders dropped visibly when someone walked in with purpose and attention and steady hands. "Hi," I said. "I'm Kovac. I'm your nurse tonight. Let's get you sorted." I'm not Saber anymore. I know that. I haven't been Saber for a long time. But the hands remember, and the work was waiting. If Sarah's story found you somewhere real tonight, if this is one you're going to carry with you, hit the like button and share it with someone who deserves to hear it. Subscribe to this channel because there are more stories like hers, and they need to be told. And drop a comment below. Tell me what city you're watching from. I want to see how far this one goes.